All right, Dean Lounsbery, we know that the students are not going back for fall semester, but what does this mean for our faculty and staff?
I think everybody on campus has heard that, there are plans for reopening. And those plans really require us to have some capacity for testing. We need to have capacity for contact tracing. We also need to demonstrate how we are going to adopt and implement the best known public health measures that we can in order to keep everyone on our campus safe. The repopulation plan is an important way for us to understand how people will come back, when they'll come back, but also, like I said, the public health measures that individuals who are on campus will need to take when they're here. I think the biggest thing for folks to understand is that there are a lot of variables that are being considered. Many of those variables are coming from policymakers and stakeholders outside of the CSU system that are certainly influencing, what we need to do as a campus. And so the situation has been more dynamic than I would like it to be. And I know all of us would really like to know what the plan is. And what I can offer all of us in HHS is just the encouragement to be patient and to try very hard to manage your expectations about a situation that is incredibly dynamic and that is really requiring us to, react nimbly to the situation as it occurs. So right now, we're really looking at the state public health advisement, clearly what the governor is advising, clearly what LA County and public health officials from LA County and the city of Long Beach are really advising relative to how we will respond to reopening. So students, of course, you've all heard, will have mostly remote learning in all of their classes, at least for the first part of fall semester. That's what it looks like now. We've asked our faculty and staff to really plan toward that outline, that we will be having mostly remote instruction. It may be possible, however, in the latter part of fall semester that, we can, move more toward a greater number of people on campus and more opportunity for face-to-face instruction. But right now, it doesn't appear that we have a green light for even thinking along those lines yet. So right now, the campus is really trying to do the best that we can to only have minimum number of face-to-face class meetings. So what this means is that for the first part of fall semester, we definitely want faculty to be planning for the fewest number of classes that will need to be held face-to-face. And then what we'll do is take a look at what those requests are, and then Grace and I, our associate dean, will be working together with our department chairs to figure out what's the best plan for those classes, for our students in those classes, to deliver the best instruction we can with the situation we have relative to COVID-19 advisement. We're hopeful that we'll get information on that within the coming months. Meanwhile, we're working on making sure that we have whatever personal protective equipment is advised for those activities that will happen in fall semester. And we want to make sure that we have very clear guidance on the recommended public health practices that will need to be in place in order to mitigate transmission, and that we train everybody on those. So that's really a critical part of what we're working on right now. In terms of staff, it really doesn't look like that we will have many staff on campus, except for those staff that have essential functions and the staff that the campus has really deemed that we need to have on campus for the remote learning and for the minimal face-to-face instruction that will occur. And outside of that, no staff members really have been explicitly identified, or the remote instruction piece relative to it. So right now we don't have a lot of clarity on what that looks like. So we need to really be thinking more of the same in terms of remote remote service from campus, from our staff. Our faculty, we're working very hard to make sure faculty have access to their offices. We know that that's critically important for them to even deliver remote instruction. We want to make sure that we know when faculty want to be in their office. The biggest thing that is the challenge for the campus is the campus really wants to stagger the number of people on campus at any one time. And so there will be lots of questions that I'm sure everybody is tired of answering. When are you planning on coming to campus and letting individuals know? But that's for good reason, to make sure that we're minimizing the number of people who are on campus at any one time, and we are able to show that we're adhering to public health guidelines in terms of social distancing and making sure that we are doing the best that we can to reduce the risk as far low as we possibly can for transmission of COVID-19.
Great. So the transition to online learning has been challenging for a lot of the faculty and staff. How is CHHS providing professional opportunities, professional development opportunities for faculty and staff?
Well, first, I really want to say to our faculty and staff, great job of being nimble and responding well to the disruption of spring semester. Everyone was, with almost no notice, asked to start working remotely. Our faculty were given a little bit of time to restructure their classes and then launch a remote learning platform. And in some cases, it certainly was less than ideal. And our faculty, at least in HHS, I believe performed remarkably well. But we also recognize that, this is not the preferred learning modality for many of our students, nor is it the preferred teaching delivery system for many of our faculty. And so the campus has really been thinking a lot about what we could do to leverage the strengths in our ATS unit, as well as strengths of faculty, to really be delivering a robust professional development program to really help us ramp up our game for remote learning in the fall semester. So what's happening right now is the deans are all looking at campus-wide plans for the kind of professional development that will be available to really maximize our pedagogical platform for delivering remote learning and providing our faculty with tips and tricks and skills and access to technologies that will really help deliver excellence in terms of our instruction this fall, despite the fact that we're remote. Soon, faculty will be given instructions on different opportunities there are for them to participate in professional development and the opportunity to sign up. There will also be stipends that are available to incentivize faculty to participate in that professional development. We're also really thinking about building a train-the-trainer model where faculty who have particular expertise and are able to work across their unit with faculty to really support their delivery of remote learning will also be trained to provide those services and skills to our faculty within each of our units. So we're working on those plans right now, and that'll be kind of the train the trainer model. We just really looked at a draft plan to do that. The chairs and directors of the HHS just reviewed that plan, gave advisement and feedback, and that was due today. So we'll learn more about what those professional development plans really are in the coming days, I suspect. But please look for that. We're really hoping that we can get everybody the kinds of skills and the kinds of knowledge and background that I feel like that they need. That's really critically important to us, is making sure people have access to the professional development that they actually need. And then I think the situation really is in the hands of our faculty to really utilize the professional development programming that we have and access to the trainer model, which we're calling a champion right now, to be able to support their planning and delivery for an excellent fall semester.
Sounds great. One last question. Many of the faculty and staff and the students feel, isolated right now. What is CHHS doing to help people stay connected and promote campus connectivity?
Yeah, that's a big issue. It's tough. Our faculty really have a big role to play, I think, in supporting our students. I think it's with broad recognition that, remote learning is a little bit foreign to us. and we aren't really thinking along the lines of what maybe our students need in a remote learning situation. But I think we need faculty to listen very closely to our students and really support our faculty in developing innovations and creative solutions to what their students are experiencing over fall semester. We really want to do that as a college, and I hope that you'll reach out to the dean's office and help us to understand what those needs are so that we can work together to figure out resolve. But in addition to that, some of you may have heard that we have a health promotions team in the college that consists of so many wonderful faculty and staff members who are really committed to the idea of promoting health, physical health and mental health. And one of the things that's been widely recognized by that team is just how incredibly isolating remote learning is for everyone. And that our students really miss seeing each other. They miss seeing their faculty live, and our faculty miss seeing each other. And our staff miss seeing each other, and that there's an opportunity for us to really think about how to promote connectivity despite, having to do so many things virtually. And so that team really launched a really neat idea, and it's a town hall meeting that happens once a month, and it's called We Got You at the Beach. And I love that because what it really stands for to me is a way of understanding that we all are in this together and we all need to support each other. And it's so important to take, the time to just reach out for reach out's sake, and to share ideas of things to do socially, and to think about how to support health, how to reduce stress, how to reduce anxiety, how to really work together as a one beach, as President Conley says. So I hope that you'll join us for the next We Got You at the Beach. I think we're going to be trying to talk about promoting health and physical activity, and I think some things around diet. So I'm really excited for the next one. We had HHS students, faculty, and staff who come to the town hall meetings. So I'm really hopeful that if you haven't had a chance to join, that you will, and engage with that team and that panel. I think a lot of really great dialogue happened in the chat, and I'm really thinking it was a first step toward connectivity. But we all have a role to play in staying connected. So reach out to your fellow colleagues, your staff members, to your students. Do what we can to support students getting together socially and really stay connected, because after all, we are all in this together and we are one beach.
Thank you so much.
Thanks.